I'm going to be doing internal feeding. First, I would use hand hygiene, but for that, I would verify my physician's order, and then I'm going to identify my patient, asking them name, date of birth, and to see their wristband. I'm also going to ask them allergies because we are doing a feeding, so you need to know their allergies for that. Okay, you are who you say you are. And then after this, I would get my bag, my feeding bag, and this is going to represent like my longevity or whatever the feeding is, and it's in a can, and I would shake that up. And then I have my feeding bag, and I would pour this in the feeding bag, and I would like hang it. And then after that, I would connect the tubing, prime the tubing, and then I would leave that alone for a little bit. Then now I'm going to grab my NG tubing, and I'm going to check gastric residual along with pH. If his gastric residual is less than 250, I'm going to return it. So keep that in mind. And then I'm going to check his pH. pH is 4. That means we're in the stomach. As I was saying with the gastric residual, if it's less than 250, I'm going to return it. His is less than 250. If you get a gastric residual and it's more than 250, 2 times an hour apart, you're going to hold feedings. If it's 500 or more, you're also going to hold / stop feedings. So now I'm going to pull up with a new syringe. I'm going to pull up some water at 30 milliliters. I'm going to flush this NG real quick. So I'm flushing. Also, for intermittent feedings, you flush before and after. For continuous feedings, you flush every 4 hours. And to retrieve gastric residual, you check that every 4 to 6 hours. But I just flushed. I'm about to feed him. I'm going to take the tubing to my feeding with Vegevity and my NG, and I'm going to connect them. Then I'm going to start my feeding as called for. Then if he had an abdominal tubing, I would assess that, but this is an NG. The administration set and the bag needs to be changed every 24 hours. And like I just said, if he had an abdominal tube, I would check that and assess the skin, and that needs to be done daily. So after all that is done, I'm going to remove these dirty gloves and dispose of these properly in the trash can, perform hand hygiene, and go document. What I would document is the gastric residual volume, what it looked like, was my patient nauseous. I would document input, output, and anything else that happened while I was in the room, subjective and objective data. And that will conclude that.